The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Today is Friday, March 31st, 2023. I'm Dr. Smalls, Director of Professional Development for Maryland's Department of Health, Developmental Disabilities Administration. We welcome you to the monthly series of DDA's updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA, Robert Wright, Director of Operations, Nick Burton, Director of Programs, Rhonda Workman, Director of Federal Programs and Integrity, and Jennifer Metrick, Executive Director of Liberty Healthcare Corporation. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. If you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting it to the DDA website and to YouTube. Today's PowerPoint has been uploaded as an attachment and is available to you to download in the webinar panel box. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. And now I'd like to introduce Deputy Secretary Simons. Good morning, Bernie.
Good morning. Can you hear me all right?
Yes, we can.
Okay, thank you. Well, I want to thank everybody for joining us again in our monthly community webinar. I mean, it's been a good opportunity for all of us to engage with each other and, you know, share important updates with everybody since the last time we were together. As Dr. Smalls just said, Rhonda Workman, Nick Burton, Robert White will be providing you with some updates related to their areas of oversight. You'll be hearing from Rhonda about retainer days because that's been a few questions that have come in with us from the provider community in our waiver renewal, Medicaid check-in, and our policies and issues around self-direction. On the program side of the house, Nick Burton will be providing some updates on LTSS, our community settings rule. Congratulations to everybody with the compliance. And he'll be discussing also our Employment First that we've been for quite a few years now, an Employment First state. And also with, I believe about a year ago, we became a Tech First state, and we're engaging with all kinds of opportunities on that. And then finally, Robert White will be sharing information regarding the 2024 COLA and the competitive grants that people have been asking about. Where are the competitive grants? Because the non-competitive we've already issued, and now we'll get into the competitive grant cycle. And then finally, Jennifer Metrick, who joins us from Liberty, will share some updates doing the work that they're doing. And then first, though, I'd like to share with all of you Governor Moore's DDA awareness proclamation. Next slide, please. So, you know, we're glad to accept and share with all of you Governor Moore's DDA Awareness Month proclamation for March. I was really glad to see the many ways that people were celebrating this past month, today being the last day of the month. So we've had a full month to be able to watch videos, see stories about what people are doing in their homes, their jobs, their communities. And while we officially celebrate DD Awareness Month every March, we know that the visibility and advocacy that people who are on this call and people who are not on this call in our DD community in Maryland, that their visibility and advocacy is consistent and constant, moving and being able to take a look at where are we going and advocating for different areas, whether it be self-direction, whether it be providers, case management, individuals and families, which is an area that we are obviously working heavily in, and we're the Lifestar and Charting the Life Course, etc. So, you know, we all enjoyed the DD Awareness Month, obviously. And, you know, we put this on Facebook, and you can see that there are pictures that we put on next to the proclamation. And just so you know that when we track, you know, how many people go in and have a hit on our Facebook, it was over 30,000. And so I want to accept you to accept my thanks for showing up, doing a good job, and keeping the issues about people we provide supports to, their families, provider community, case management, and regional office, etc. That, you know, it does, all of this work doesn't go unnoticed, and I think we're all better for it in the long run. Next slide, please.
Hi, good morning, everybody. My name is Rhonda Workman. I am the DDA Director of Federal Programs and Integrity, and I'm going to share some updates in my area. Next slide, please. First, we're extremely happy to share that the Center for Medicare and Medicaid Services, or CMS, has approved the DDA's Appendix K amendment to end the Appendix K related residential retainer days with an effective date of January 1st, 2022. This effective date of January 1st provides opportunities for providers who have not accessed the Appendix K retainer payments or have exhausted Appendix K retainer payments. They may now access the retainer payments as stipulated in the Community Pathways Base Waiver. We have updated the DDA Appendix K guidance memos, the at-a-glance documents, and the termination chart on our website to reflect these changes. We'll also be issuing information, a communication out to alert everybody to the information. And we know if you have some questions related to retainer payments, we're asking that you direct those questions to your regional office so that they can help you if you need assistance with that. Next slide, please. This slide is related to our recently communicated information about our webinar that we'll be conducting on April 21st from noon to 1:30 regarding the unwinding of the Appendix K authorities. To register the webinar, please use the link included on this slide. And during the webinar, we will also highlight the flexibilities that will continue under the DDA operated Medicaid waiver programs. Next slide, please. This slide is an update to the DDA waiver renewals. The department responded to initial questions from CMS. The Office of Long-Term Services and Supports, our department's Medicaid office, has updated the waiver portal with information that CMS requested be included. The next steps for our process includes CMS final approval. The DDA then will post updated track change documents. We will also update policy and guidance to align with the July 1st, 2023 effective date and the changes reflected in the renewals. And we'll be sharing stakeholder information and training related to these changes so that we're all on the same page and can continue to support these great flexibilities. Next slide, please. This slide is related to the Medicaid Check-in 2023 campaign. You may recall that the DDA has recently shared some communication with all our stakeholders related to this effort. The department has a statewide outreach and communication strategy related to this Medicaid check-in process that began this month and will run through April 2024. The key objectives, the key focus areas for this effort is to encourage all Medicaid participants, including DDA-funded participants, to update their contact information. It is also to generate awareness of the redetermination process statewide using various communication and media strategies. You will start to see information on TV and billboards and such as we continue through this campaign. Next slide, please. This slide includes links to some of the various communication tools available today related to the Medicaid check-in campaign. Our department has specific dedicated web pages with participant information and a separate page for provider information. We've also included the link to the DDA's March 14 communication related to the Medicaid check-in for your convenience. Next slide, please. This week, the Department of Human Services sent out letters to people to alert them to this upcoming redetermination. Some of our coordinators of community services and providers who have been identified as representatives for the person's Medicaid financial eligibility may have also received a copy of the letter. Important actions that people can take today include creating a MyMDThink account if you haven't already done one. MDThink is Maryland's system that includes direct access to the participant's Medicaid eligibility status, Medicaid letters, and notices. It's important that you make sure that the MyMDThink account has the current mailing address, phone number, email, or other contact information in the system. Once you've established your account, you can access your Medicaid case details and manage your account information, like updating your contact information if it's needed. Please note that you must have an email address to create a MyMDThink account. If you don't have an email address, you can still create one with help from a family member, your coordinator of community service, or provider of your choice. Next slide, please. This slide includes information on steps people can follow. It includes to review or update your contact information online. Basically, you would just log into your account and review and update your address, phone number, and emails. Again, it's important as the key objective to have current information, so when the redetermination letter is sent out, we can make sure it gets to you at your correct address. Again, if you already have one, you can click the button to create an account. We've included links to the direct sites so that you can access them easily. And then if you need assistance, there's some resources available, including the Department of Human Service call center. So we've noted the 1-800 number here. Help is also available in more than 200 languages. And there is also relay services available if needed. You can also visit or call the local Department of Social Services or your health department for additional assistance. Next slide, please. This slide includes information on how our coordinators of community services, participant team members, and DDA providers can assist people with the redetermination process. They can help access the person, or can help the person access the Maryland MDThink account and help them to set them up if they don't already have one. In June or July of this year, CCSs and DDA providers will also be able to see the redetermination date for the people they support when checking the Medicaid Eligibility Verification System, referred to as EVS, for medical assistance. We've included a link to the EVS system and also email addresses for questions that you may have. Next slide, please. Now we're going to transition and talk a little bit about our transitioning youth. So transitioning youth, or TY, are associated with the current fiscal year, are often referred to as TY23s. As noted on the slide, they are youth that have graduated or aged out of the school system last year on June 2022. Their transitioning youth funding eligibility under the DDA regulations began on July 1st, 2022, and ends this June 30th, 2022. For youth that have not already completed the DDA waiver application process, we want to remind you that the Medicaid waiver application must be submitted no later than June 30th, 2023, in order to be considered for the TY funding. Please note that the autism waiver transition to youth from 2021 and 2022 are also considered as part of our DDA TY23 group. These youth had the opportunity to stay in the autism waiver under the Autism Waiver Appendix K flexibilities. Next slide, please. This slide relates to transitioning youth for 2024. As noted on this slide, they are youth that will graduate or age out of the school system this year in June 2023. Their TY funding eligibility will begin this July 1st, 2023, and ends June 30th, 2024. We have noted on this slide a change in practice related to the actual Medicaid waiver application. The Office of Eligibility Services has informed the DDA that the Medicaid waiver application cannot be signed by youth or submitted before May 15th, 2023 for a start date of July 1st, 2023. This is due to the new MD-Think E&E system requirement for a determination of waiver enrollment within 45 days of the application signature date. Transitioning youth, with the support of their teams, should work with their coordinators of community services to develop their DDA person-centered plan and can complete all other DDA waiver application packet forms at this time. To summarize, the key points for this slide is that for TY24 that are seeking to start services July 1st, they will need to sign and date the actual Medicaid application on May 15th or soon after. That Medicaid application with all supporting financial documentation then needs to be provided to the coordinator of community services so they can submit to the DDA with the DDA waiver application packet in LTSS. The DDA waiver application packet will then be prioritized for review by the DDA and the Eligibility Determination Division, or EDD. For youth that are seeking to start services in the fall or later on, please note again that your TY funding eligibility timeframe, you have until June 30th of 2024 to submit the Medicaid waiver application packet to be considered. Next slide, please. This is an update related to the DDA stakeholder input process. The DDA is committed to seeking input on policy proposals from people, family members, coordinators of community services, community providers, and advocacy organizations. During our last webinar, we shared that the DDA will announce and post proposed policy for stakeholder feedback in a new dedicated webpage. On March 22nd, we issued policy update communications noting that public input was being requested for family and peer mentoring supports and transition supports. This input is due by April 6th to the DDA. We also announced the publishing of assistive technology and services policy and the environmental assessment and modification policy, which can now be accessed on PolicyStat. Following the stakeholder input period, the DDA updated our proposed policies, summarized the recommendations from the public, which are posted in final track change versions on our dedicated page under the archive link. We've included a link to the archive link here on this page so that you can quickly access if you'd like to review the stakeholder input received and the track change documents. We have reviewed stakeholder input on the family caregiver and empowerment services policy and the participant education training and advocacy support service policy, and we will be publishing these policies soon. The next policies that we will be issuing for public comment are live-in caregiver supports and remote support services. Next slide, please. And finally, we'd like to share a couple updates and reminders related to self-directed services, so that we make sure that these critical processes and supports with the final FMCS transitions are supported. It is important to reach out to your FMCS agency for assistance if you do not have access or have challenges associated with accessing the FMCS webpage portal. The FMCS portals include the ability to electronically submit time and invoices for non-electronic visit verification services. And the FMCS portals also include information related to expenditures paid to date so people can manage and stay within their authorized budget. The DDA has been working with advocates and the FMCS agencies to update the fiscal management and counseling services guidance, and will be sharing this information with stakeholders soon. Next slide, please. This slide includes our FMCS contacts available to help and answer questions and help resolve issues. So we've got GT Independence, Public Partnerships, and the ARCA Central Chesapeake, including their customer service line, customer service email, and a designated representative email. Next slide, please. This slide includes DDA staff that are available to answer questions and help to resolve issues related to self-direction. It includes the department's fiscal management and counseling service program manager, Monica, Christy, our DDA statewide self-directed coordinator, and our self-directed leads in each of the regional offices. Next slide, please.
Thanks, Rhonda, for those robust federal program updates. Like Bernie said, I'm going to give you guys some updates on the program side of the house. We're going to talk a little bit about LTSS, community settings role compliance, PCP enhancements, and some employment first and technology first updates. So next slide, please. Okay, LTSS. I think yesterday was opening day for baseball season, so I'm going to use a baseball term here. We've really knocked it out of the park for the 4-1 go live, which also is the end of our 3A transition. If you look here down at the bottom, the chart here that says active providers that are all in, partially in, not billing at all. As of April 2023, which will be tomorrow, 35% of our providers will be all in, 46% will be partially in, and 19% have not yet started billing in LTSS. So phenomenal, really amazing. Everyone's been doing such a great job on the PCPs, the provider readiness. That's not only showing up in just our day-to-day data, but then also when people are starting to bill, when you guys are starting to bill, we're seeing that the exceptions rate is extremely low. So that's good. You're billing, you're getting the money, and you're able to provide those services. The other thing I wanted to share is that probably within the next week, you're going to receive an LTSS transition survey. It actually kind of started in the early adopter group in terms of wanting to get a good sense of where people are in regards to their transition. And then we also looped in the Employment First Committee to kind of really focus on some of those meaningful day services. So that survey is being reviewed right now internally. It's been finished. The Employment First work group was very instrumental in its creation. And so we will get that out in the next probably week or so. So pay attention to it, and there'll be a communication to let you know how long that survey will be open. But I hope you'll fill it out, because it'll really help us as we're starting to think about this stretch into 2024. But great job. We've also been seeing a lot of providers that are scoping through 12.1. So let's keep the scoping up, reach out to your regional directors. Now's the time to get in while it's hot. All right, next slide, please. Yeah, a couple of LTSS, while we're talking about LTSS, I wanted to share some enhancements that are coming down the pipe for all of you that I think will be helpful as we continue to enhance the system so that there's greater access, transparency, it's easier to use. One of the things that will be enhanced for CCS is being able to manually create a CCS monitoring and follow-up form. Of course, we'll provide some more information on what that looks like and some guidance in terms of when you might use that and the reasoning for it, particularly at the CCS monthly meet or the CCS bi-monthly meeting to look at that. We'll make sure we go over that process. And then on the provider end of things, you're going to start being able to see the community services questionnaire, the CSQ. You'll also start to see the contribution to care as well. So you'll have access to those. You'll be able to see the CSQ and what the answers were. And we're going to talk a little bit more about the community settings rule, ongoing compliance, where that's going to become applicable as well. Next slide, please. All right, community settings rule. Again, I just want to echo what Bernie said. Phenomenal job. Everybody's compliant. Things are looking really well. We've got a guidance in place and the community settings questionnaire in place. They're posted on our website. I just wanted to remind everyone to remember that the community settings questionnaire really is a collaborative process. We want CCS to feel comfortable engaging with providers and with people and to really have a conversation about the CSQ process and to ask questions and to really use the CSQ questionnaire manual that we created so that you guys can engage in a collaborative process and there's transparency about what they might ask, the CCS might ask, what they might be looking for. And again, not a gotcha, not anything like that. It's really about being able to make sure that together the person is living in a setting in the community that is in compliance with the final rule. We are going to be working on a training regarding the community settings rule and the community settings questionnaire. Nicolette and Leslie are working closely on that, and I know they're actually going to be reaching out to some of you to get your input on that training and also see if some people would like to be guest stars in the training so that we can truly demonstrate that collaborative process and potentially do some role playing as well with CCS and providers on really what that looks like in the process. And then the last thing I wanted to just mention about this is, as you know, per the community settings rule final guidance, that DDA has started a validation committee. It's my understanding the validation committee met for the first time and it went really well. It was a very collaborative process. There were no issues to follow up on, so that was great. Things are continuing to stay compliant. But I'm really excited about that validation committee, and I'm really excited about the work that they're going to be able to do with all of you if something were to pop up. So use them as a resource too. If you have questions about community settings rule or the community settings questionnaire, please don't hesitate to reach out to Leslie on the provider side of things and or Nicolette on the CCS side of things. All right, next slide. Okay, one of my favorite topics, person-centered planning enhancement. So we have, obviously, you know that we did a family forum where we leaned pretty heavily into the person-centered planning process and the enhancements and the work we're doing with UMKC. We're going to do the same with CCS and providers. We're going to do them regionally, and we're going to have it as a joint meeting so that CCS and providers are together. They're hearing the same thing. We're going to do it by region so that you're not traveling all over the state, particularly if you live on the Eastern Shore or Western Maryland. We want to make sure that we're meeting you at where you all are at in the communities that you're providing the services. So we should be sending out a save the date soon. I would say look for it in the next few weeks maybe, and then we'll get those going. We are collaborating with the regions to make sure that we're not picking timeframes that interfere with anything else. We also want to pick some timeframes, understanding that TY season's coming, and we also want to make sure that we don't interfere with all of your summer vacations, but still want to get this going and really start moving forward. The kickoff meetings will really be informational. They will be kind of a call to action. They will be energizing. They'll be fun, exciting. We want to hear your ideas on what things look like as we move forward. So I think they should be a really good time. The other thing that I'm really wanting to start identifying and looking for are folks that are wanting to be champions as we move forward with the person-centered planning enhancements. And by champions, I mean you are committed to the person-centered planning process and the life course principles through charting the life course. You're really committed to this. You are passionate about person-centered planning. You love a PCP. All of those things. We're looking for champions. So as we have these kickoff meetings with CCS and with providers, if you feel that you'd really like to be a champion and would like to join efforts in helping spread this word, really helping get the message out, really quote unquote championing the work that we're doing, I'd love to hear from you. I've already had a few reach out. So the last thing I wanted to say is that in the next couple weeks, you are all going to get a communication about essentially a call for participants to join a person-centered planning enhancements implementation committee. And I promise it will not be a mouthful like that. We will come up with a much easier acronym or title. But essentially looking for a committee of people in the DDA community that want to come together and help us implement the person-centered planning enhancements that have been recommended by all of you, by people, by families, by UMKC, by NASDs. We want to start moving on those and get them implemented. We want that committee to be a diverse representation of the community. We want to ensure there are actual CCS on the committee. We want to make sure there's actual DSPs on the committee, people with disabilities, family members with disabilities. We want to represent all the regions. We want to represent all the cultures. We want to make sure it's a representative committee. We also want to be mindful of how big the committee is. So we are going to have a limit on the number of people in the committee so that we can actually get work done. But again, we want it to be representative. So pay attention to that. There'll be a process for you to submit your interest. And from there, we will choose the committee members and we'll announce that. And then if you're not on the committee, you don't have time, or you're just unable to participate, there will be regular updates of the committee's work, and we will share those at this monthly meeting, but also via other venues as well. All right, next slide, please. Employment and technology first. So as Bernie said, we are an employment and technology first state. We believe that anyone who wants to work can work, and we also believe that we can lead with technology, really looking at technologies as a form to support somebody and increase their independence, whether that be at home, work, or in the community. We recently just had our first Tech Tuesday webinar, and I apologize for the technical difficulties, which is interesting, for a Tech Tuesday webinar, but we have re-recorded that webinar and we're going to be sharing that with everybody who registered in the general public anyways. It's a really great webinar, so take a look at it. It has some really great examples of real people utilizing technology to improve or to enhance their lives, so please take a look at that. We are making sure that the next Tech Tuesday is technologically savvy. We're also going to have a drawing for a gift card for people that register and participate in the next one. So please check out the communication we sent out on our Tech Tuesdays webinar series and get signed up. Also, we had our first joint DDA Endorse training last week, or this week. It was great. It was a very brief introduction onto the work that DDA Endorse does together. There will be 4 or 5 more trainings over the course of the year. Again, they're going to be based upon the collaboration between DDA and DOORS. It's going to talk about, the stacking, grading, blending. It's going to talk about how to access DDA, how to access DOORS. What does it look like when somebody's ready to transition? So I really encourage, particularly people, families, CCS, I really encourage you to train or attend those trainings, and providers absolutely attend those trainings, but absolutely also look into DOORS in regards to any process on becoming DOORS vendors as well. And that will make sense if you watch the recording from the most recent DDA and DOORS training. I also wanted to just let you know, and we've communicated this, but we made some enhancements to the job development section of our Meaningful Day Services policy. The enhancement that we made is, based on research we've been doing and communication about best practices across the country. We have determined that we will fund 50% of job development being indirect. And so if you go take a look at our Meaningful Day policy on PolicyStat, it's updated with that information and some of the criteria around it. So please go take a look. And if you have any questions about that, you can reach out to Casey Venn, who is our statewide employment coordinator, or you can also reach out to myself. I also wanted to share with you that the Employment First Committee has come up with its 2023-2024 outcomes, goals and outcomes. They are posted on our employment page. I think they are pretty great goals. They have a lot on their plate this next year, but I'm really excited about the work that the Employment First Committee is doing to really advance employment opportunities and to make sure that we continue on our path towards competitive integrated employment for all Marylanders with developmental disabilities who want to work. All right, I think that's the end for me.
Thank you, Nick. It's a lot of great things going on in programs. So thank you, good update. Next slide, please. So today I wanted to give you an update on the FY 2024 rate calendar. The rate tables will be updated and shared shortly after we have the final approved budget. But effective July 1, the rates will be updated to include the 4% mandated COLA that will be applicable to both systems, so the rates that are in PCIS2 as well as the rates that are in LTSS. In addition, for the fee-for-service rates that are being billed in LTSS, we'll be making an adjustment to the Meaningful Day transportation component based on work that was done during the last rate review advisory group cycle, so last year. We'll also be increasing the funding percentage for the Meaningful Day rates. As soon as we have that final budget language and understand how the accelerated COLAs for FY 25 and 26 are to be applied, then we'll also update the rate table to reflect those changes and get that out to you all as well with the effective date so that you have access to that as you continue to plan. Next slide, please. So the grant application has closed for competitive grants. If you recall, these are the ARPA grants that we're offering have a total of about $5 million for those competitive grants. We received a total of 137 applications, totaling $24.4 million. So we've already started to look at those applications and go through that process. And so, you know, we also have a revised timeline that we wanted to share with you. So the hope is that on May 15th, we'll be able to get those award letters out, and then we'll start funding those grants, the grants that were approved, starting July 1. So the money is actually in the FY24 budget, so we wouldn't be able to fund anything prior to July 1. And that concludes my update, and I'm going to turn it over to Jennifer for a Liberty Healthcare update.
Thank you, Robert. Good morning, everyone. Today, I'll be reviewing updates on the progress of Liberty's work in partnership with the department to be able to evaluate system performance across many aspects of the system, as well as our pursuit towards person-centered excellence. Next slide, please. So this slide demonstrates Liberty's core components that we will be working with the department side by side on. It also demonstrates all of the data collection tools that we'll be using to evaluate system performance and person-centered excellence. And then it also walks us through that demonstration of using all of that data that we'll be compiling both by review and also across reviews so that we can report out on performance data by quality domains, by provider types, service types, regions, and a variety of other factors so that we're really supporting a data-driven quality improvement strategy development process with the department. So we'll use the data to help the department determine what are the next quality improvement strategies that they'd like to implement. Then we'll be able to continuously monitor whether those strategies are having the desired impact on people receiving services in the system. So we'll have that nice continuous improvement feedback loop. So next slide, please. So here we have those three main components of the Liberty work, and I wanted to provide a few updates on where we're at so far. So we'll start with the work that we're doing around system quality and participant outcomes. That is all of the data collection work that we're doing in partnership with the Council for Quality and Leadership to try to help move us towards a statewide network accreditation with CQL. So we've had a lot of great things happening since February. We had a kickoff overview training for both Liberty staff and DDA staff in February. We have now gotten all 6 of Liberty's reviewers that will be doing this work certified in the personal outcome measures. We have 2 of those 6 are going to be certified as trainers of the personal outcome measure. And the next step is to have them certified in the basic assurance reviews with CQL. So we had many providers step up and agree to participate. So thank you very much in that process to certify our team members to do those basic assurances. So it's a pretty extensive process. We had over 12 providers that reached out to participate. We have 9 set up right now for those basic assurance processes. So they will be happening between April and May. So that pilot gets kicked off on the 18th of April. All of the providers that are participating in having our staff certified in the basic assurances, they all received a very long, over 4-hour training from CQL. last week. And so now they're preparing to participate in those reviews. There will be basic assurance training for all providers. That is going to happen towards the end of May. And I did have one correction to the slide today. Those dates are going to be May 15th, May 16th, May 17th, May 23rd, and May 24th. A communication is coming out shortly that will have the registration links for each of those dates. So you only have to sign up for one date as a provider. It's highly encouraged that you participate in these in those live webinars that will be jointly done with CQL and Liberty, so that you're prepared for what is in store for those basic assurance reviews, what to expect, really understanding the purpose. They're really very much quality driven to help support providers on their own pursuit towards person-centered excellence. So we'll be going through all of that detail on those training dates. So please look out for that. I did want to also do a quick shout out to the ARC Carroll County and to Optimal Healthcare, who both hosted personal outcome measure workshops with the Liberty team and CQL. That was helping the Liberty team members be able to become certified trainers in personal outcome measure. So we really appreciate your participation in that, and those went really well. I think the last one was this week. So now let's talk about a few updates with the National Core Indicator Surveying. This is our opportunity to really be able to connect with participants and families so they can share their voice, their experience with services and how that's going. So far we have, I think we've actually, since I updated this, we're closer to almost 300 participants that have shared their voice in the NCI in-person survey. So it's really exciting. We have many more interviews scheduled. We're definitely going to exceed our goal or our target of 400 interviews by the end of June. So thank you for all of the CCS agencies, provider agencies, individual CCSs that have really helped us to connect with people to see if they would like to participate in the survey. So those efforts have really helped, and we appreciate it. We also have heard from over 630 families, so either family members that are living with a loved one with a developmental disability, or through the Family Guardian Survey, which is for those that aren't living with their loved ones. So those two surveys have gone out now twice. We've done 2 mailings. We're looking at some additional strategies to really get us over at least 800, 400 each for each of the family, the adult family and the Family Guardian Survey by the end of June. So look out for more. This is a really important survey, so please talk it up. Families, if you haven't seen it, we do have a 1-800 number. We'll post that on the QIO page of the website. So if you haven't received a survey, we really want to hear from you. We'll mail it out directly to you so that you can share your voice. So finally, we come to more of our systems compliance, our waiver assurance monitoring. We have many different aspects of those evaluations that are either have started to launch or are coming soon. So we have started our targeted case management reviews. So these are reviews that evaluate for the system everything from level of care determinations or redeterminations, the person-centered planning process, monitoring and follow-up, as well as TCN billing requirements. So the reviews are pretty comprehensive. We're over 51% complete on the reviews that we have to do by the end of June. So we'll have aggregate reports that are going out to CCS agencies that are providing that information on where we're at in terms of meeting performance measures and certain indicator questions. And they'll also get information about their billing reviews. We have made a few changes, modifications to how we're providing the reports to CCS agencies. We've updated the standard operating procedure accordingly to that, and we'll be reissuing that shortly next week. So please be on the lookout for that. We also had a webinar yesterday for the kickoff of the utilization review. So these are claims reviews. These are random claims reviews that we will be conducting starting on April 17th. And so if you missed the webinar yesterday, that was recorded. It will be posted most likely by the end of the day today on the DDA website. So you will be able to access that information. There was a PowerPoint also associated with that. And there is a standard operating procedure for those utilization reviews. That will also be going out next week so that you have all of the information about the steps of the process, what to expect, and how you'll receive information from Liberty staff around that review. So we do have, you can go to the next slide. Thank you. So this slide demonstrates the reviews, their launches, the fact that we've been piloting the reviews before launch, and when the projected go live dates are. We have modified this over time. So what's up next, obviously, is the go live for the utilization reviews on the 17th. We'll also be starting, as I mentioned, the Council for Quality and Leadership's data collection, as well as we'll be piloting a qualified provider review. And those things also will be going live, slated for the end of June. And we're also going to be piloting a health and welfare review that's really looking at the critical incident process, and then going live again towards the end of June. So those are the updates. And I think I will kick this back to Bernie for closing remarks. And you have my contact information, so please email me if you have any questions.
Hey everyone, I could go ahead and jump in here. So here's a link to our next webinar, and so you can share with your colleagues, families, and participants. And after you register, you'll receive some confirmation information about being able to join. And now, your favorite part, we will do questions and answers. You want to kick us off with that, Dr. Smalls?
Hello, if I could interject.
Okay.
This is Robert. Sorry, Dr. Smalls, but I wanted to just mention that the slide related to the COLAs had a typo, and so those increases will be effective, the 4% COLA will be effective July 1 of 2023 for the FY 2024 fiscal year. So I just wanted to correct that because I see we've gotten a lot of questions related to that. Thanks.
And Robert, since there was one other edit, I think with Jennifer's slides, we can update that and post it for everyone. So this edit that you just mentioned will include as well. Okay, well, let's get to the questions here. Got some good ones. All right, first question. It's noted that when you use the someone mentioned when you use the registration link that the dates for the upcoming webinars aren't being added to your calendar. We'll review that. And if it's still not working or functioning appropriately, we'll update it. So thanks for asking that. Next question. Are we on track for the waiver renewal for the Community Pathways, Family Supports, and Community Supports waiver with a 7/1 effective date? And that question goes to Rhonda Workman.
Yeah, thank you for asking the question. The answer is yes. CMS had asked us to submit our renewal well in advance so that they could get through it. So we are definitely on track for their review and approval. And then, as we mentioned, we will start to update guidance and be sharing information and training so that we're all ready for the changes that will be taking effect July 1st.
Thanks, Rhonda. This next one's for you as well. Can organizations create an agency MyMDThink account when they act as rep payee for many people, similar to the ABLE accounts?
Yeah, that's a great question. And I see we've got a lot of questions in here related to the Maryland Think account. And we'll take that back to confirm with our Medicaid partners. But it's my understanding that if a participant is unable to create one because they don't have an email account, that the CCS and provider with the participant's authorization can assist them in either creating that email account or creating an account using that entity's email. I do not think an agency can create an account and be able to see all the people that they support because the system does not have that information in there for them. So these accounts are very specific to participants and having the ability for the participant, their authorized representative, right, to go in to see that information and update the contact information.
Thank you, Rhonda. You're up again with this next question. How can we help our individuals create an account for MDThink? And I'll if I notice that there are a number of those, I'll hold off because I know you said I'm going to go back and review them.
Right. So in general, right, some people just don't know how to create an email, right? And there's various platforms that you can create and establish an email. So you could assist them with that. Or as I mentioned, you could, if you're their representative, utilize your email to create that account. That's my understanding.
Okay. Next question, also for you. Can one email address and or mailing address be created for multiple people for the redetermination process?
So if you're talking about accessing the MyMDThink, the answer would be no. It's person specific for that. So you wouldn't be able to do it. I see this is coming from one of our provider agencies. So again, as we mentioned, to get information related to people you support, the coordinator of community services and the DDA providers will be able to gain access to that information in the EVS system. That's the Medicaid system where you check for a person's specific Medicaid eligibility to include waiver eligibility. And that's, you can access that daily. You can go through that process to see that.
Okay, thank you. The next question is also for you. And there's these next few, Rhonda, are all yours. So if you need to take a little break, let me know. The next one is, would you please clarify if the Medicaid check-in 2023 is only for people who require MA redeterminations?
So my understanding is that redeterminations are being completed for the Medicaid population. Our practice and history has been a subset of the people that we support. Please note that Medicaid can do an ad hoc review for anybody related to determinations. So at this point, we want to just really stay focused on the first goal, which is to make sure that everybody's contact information is update and current within the system. And we provided the ways that you could do that.
Great. This next question is also for you. Are there still plans for a training on the role of nursing support services in self-directed services?
Yeah, great question. Yes, we will be focusing on self-directed services, nursing support services. Per the Self-Directed Services Act from 2022, we are establishing a work group that's going to be looking at nursing support services under the self-directed model to include how to recruit more nurses to be available in addition to training information.
Thank you. And I think this is the last one for you for a minute. Rhonda, if someone is in self-direction but gets personal supports, EVV, does this mean they will show up in LTSS?
So that's a great question. The answer is no, because for self-directed services, we authorize the service in LTSS, but the providers are not indicated in the PCP, and so therefore they would not show up in LTSS. Participants self-directing their services identify either the staff that they will be hiring as employees for direct support services, vendors, or providers, and they note that with their fiscal management agency, their financial management counseling agency, who then would set them up and be paying them. So they are not going to show up in LTSS.
Thanks, Rhonda. This next
Dr.
question, yes.
I think we're at time, and we want to be respectful of people's times. Do we want to maybe take one more question and then we can answer the rest and send them out via our FAQs that we normally do?
Yeah, that sounds like a great idea. Well, then this next one, Nick, is for you.
Okay.
When will providers be able to see clarification requests in LTSS?
A good question. We are actually working with LTSS, our partners, to make enhancements so that after we roll out the My LTSS access for people, then we will starting on phase 2, where we'll start working on provider portal access to start seeing some of that based upon the individual agreeing. So I would say keep paying attention to communication around that. As soon as My LTSS rolls out for people, then we'll start rolling things out in the provider portal for greater access to the PCP for providers.
Great. Thanks, Nick. And thank you all for attending. Yes. And thank you all for attending today's webinar and for posting your questions in the question box. As always, we value your feedback, and we review and respond to frequently asked questions by our regular updating of the DDA FAQ document. So we will try to get to all the questions that weren't answered today in today's webinar. Thank you again for your dedication to our DDA community. We hope you'll join us for our next webinar, which will be on April 28th, 2023 from 10:30 a.m. to 11:30 a.m. Have a wonderful rest of your day. Bye-bye now.